Hello, everybody, and welcome to another episode of the Practice Pulse podcast. It is with great pleasure that I get to talk today to Dr. Rishita Jaju, who is a dear friend, a practicing pediatric dentist, and also a TEDx speaker. Welcome, Dr. Jaju.
Thank you so much, Aditi. Thank you for having me. It has been my honor to be a part of Practice Pulse podcast, so that I can connect with the audience and kind of have a good conversation with you. It'll be interesting to see where our conversation goes today.
Absolutely, absolutely. I'm going to share a little bit about you. Dr. Jaju is a board certified pediatric dentist and founder of Smile Wonders in Reston, Virginia. She's a Harvard trained mommy dentist, a TEDx speaker, author, and a published expert in pediatric laser dentistry. Dr. Rashita's expertise in laser dentistry and passion for infant oral health care come from her experience in providing care for thousands of infants, toddlers, and children with feeding difficulties over the past 15 years. She's one of the few pediatric dentists in the country who has achieved advanced laser proficiency certification and membership status from the Academy of Laser Dentistry, as well as breastfeeding specialist certification from Lactation Educational Resources. Her service as the chief resident and visiting faculty at Children's National Medical Center, the Council of Clinical Affairs for American Academy of Pediatric Dentistry, and as part of the exam committee of the American Board of Pediatric Dentistry has given her a unique opportunity to have a positive influence on this profession. When it comes to research and publications, she can be found in peer reviewed journals on topics of pediatric dental care for patients with special health care needs, behavior guidance, pain management, and lasers in dentistry. Each year, she participates in Give Kids a Smile initiative to provide pro bono care to children of Northern Virginia in an effort to give back. Dr. Rashida and her husband are both proud UGA bulldogs who adore their son and two Maltese doggies named Kaju and Kofi. And they have traveled all over the world together and visited every continent. And she's working on Antarctica next.
My son wants to keep going, so keeps mentioning Antarctica has this and Antarctica has, he's 5.
Yes.
So anytime he's learning about different parts of the world, it gets interesting to hear. Thank you so much for such a nice and detailed bio description.
Oh my God, because we have to get really detailed because you have achieved so much that we have to share with our listeners all your achievements and how wonderful you are in what you're doing. Because it's such a niche sort of place that you are practicing at in terms of procedure wise. And there's so much thought that has gone into discovering lasers in dentistry, and how it can help, moms with kids with feeding problems and how it affects them long term. So really, there aren't too many dentists in the country who use lasers and provide care. So why are you so passionate about it? What got you started?
Great question. So I was, coming out of specialty training and things like that during that time, and I don't want to date myself, but yes, almost 20 years ago, lasers were not that much. Right now there are not too many doctors using it, but there was really fewer doctors using it at that time. I got introduced to lasers at one of the conferences of Academy of Laser Dentistry. I was an associate in a practice that was going that route of incorporating lasers. And one of the things that got me really intrigued was how we can make dentistry accessible, fun, and pain-free for children, because that makes it a big deal. Like, you don't want, like, I didn't want to be the dentist that people or kids are like worried to come to. I wanted to be the fun Auntie Rishita, and I can only be fun Auntie Rishita until I keep doing cleanings. And as soon as I had to do some work, then are you going to give me a shot? You know?
Right.
So with the idea of lasers really, really intrigued me at that time. And I found water laser, which is all tissue laser, and I can do fillings and things like that without having to use a shot, right?
Mhm.
Then, as I was getting more into using the lasers and going to some of these conferences, because we spent so much time learning about how to use the handpiece, the
Mhm.
drill, right?
Mhm.
And then sometimes it is you go through all this experience of learning how to use the handpiece, but then you take a few training classes for lasers and now you're supposed to use it,
Mhm.
which is I feel like is one of the barriers why it hasn't necessarily become a standard
More
of care,
mainstream.
right?
Yep. Mhm.
Or mainstream. But because I have that personality where I was like, I need to learn everything about it to be able to do it safely, effectively, and do it well for my patients. I went to every single conference, every single course that was being offered about the principles, how to use it effectively, different services, and things like that. And at one of those conferences, I ran into one of the pioneers of infant care and tongue tie and laser use for frenectomies and things. And he's like, "You're in Virginia. You are using lasers, and I have patients traveling from your area all the way to me, and he's in New York. And so he's like, you need to figure out how to offer better services to more patients using your laser." And I was like, I don't know what you're talking about. I don't see patients before they have teeth. I'm a dentist. And he's like, you are one of those people that I feel is kind of limiting our profession. You're limiting to dental work and you're limiting to dentistry versus your expertise, your education and everything is about the mouth and the oral function.
Mhm.
And that started my journey on infant oral health, right?
Wow.
Like, so I started learning about that and then offering lasers for patients outside of just fillings and teeth and decay and stuff like that. Started really, really using the lasers for applications for teeth and gums and soft tissues of the mouth. So it kind of became a little bit of a labor of love, passion, things like that over time. So
That's
that's
amazing.
why.
So you were the one who said you said yes, of all the people. I'm sure there have been many dentists who have been to these courses, and but a lot of them probably said, well, like you, but I'm a dentist. I'm going to stick to teeth. But you saw a need where you said, okay, there is a need. I am going to step into this role. You stepped out of your comfort zone to realize that I'm going to fulfill this need, and that really, really that takes courage, and it takes a lot of how do you call it shifting of your mindset, and that, Rishita, I mean, that itself is true entrepreneurial trait there, that I'm going to shift my mindset. I'm going to provide the care that these patients so sorely need. And sometimes all it takes is one person. And, what a true blessing that you have that in you, that you were like, I am going to go to every course there is out there for this thing. So, and it's funny how that's where you meet the best people, where it's usually always takes one conversation. And
You're
so
right. And
that's
that's
so
kind of
amazing.
similar to how we met, right? It takes one conversation. And I was so amazed by how good you were about talking about, do the right thing, Rashida. You need to do the trainings. You've learned, you talk about this stuff. You need to help spread the word. And you encouraged me really to be a part of this podcast. And I'm so grateful for that because that really helps me figure out, get my message out to more providers and more people and more of your listeners where we are only how good we can make ourselves to be for our patients. And if
Correct.
there is a need and you have the ability to step in and help out,
Mhm.
take on. I mean, it's like,
Take it on.
understand your assignment.
Absolutely, absolutely.
Yeah.
So, what is Smile Wonders? And, why did you open your own practice? And
Oh, yeah. It's a little bit of a connected type of, conversation. Also, I will also say many times, and I meant to mention this before, and I'll tell you why Smile Wonders came about, was, I went to Harvard Dental, which is a small dental class, very close knit family. Most people, and one of the reputations Harvard has is, everybody who goes there essentially is not just a dentist. They are doing more. And, you can look at it both ways. They're not just a dentist, or they are more than a dentist, right? So it was always sort of in me where my mindset had always been, I want to give back to the profession. I want to do something more than just sort of drill and fill dentistry, right? And so I've had that my passion, expertise, and calling was with patients that were not easily served, right? Which includes pediatric patients with fear,
Mhm.
pediatric patients that have some medical or behavioral reason for not having the easiest, smoothest experience. And sometimes, some appointments start on the floor
Mhm.
outside the bathroom
Yes.
or in the play area
Mhm.
or just on that strawberry chair
Mhm.
on the reception
Mhm.
part of the practice.
Right.
And we slowly bring them and then make them a little more confident, a little more comfortable, use distractions, things like that, and get to a good place.
Right.
So it doesn't fit in your normal standard
Drill, fill, and bill.
prophy, yeah, drill, fill, and bill, or prophy fluoride type practices.
Yeah.
High volume. It's a well known kind of thing that most pediatric practices have to be a high volume
Mhm.
practice to be able to be viable, successful, profitable, things like that. However, my my thought process or my practice style or the way I was functioning, I felt like was not going to be fitting into that standard mold. I tried. I tried. It didn't fit in because many times um patients would love, they keep coming back. So if your metrics were about retention, patient loyalty, frequency of visits and trying to the where did we come in
Mhm.
the so if your metrics were that, I was doing great. But if
Mhm.
your metrics were how much did you produce today, I was pathetic,
Mhm.
right? So some days were really, really good, some days were not, and I was never like a production type
Mhm. Mhm.
mindset anyway. Then it came to this whole new niche of moms and babies. So now I am actually spending my time talking with the moms and talking with the family on like, how can I help you? What is the is a pediatric dentist your
Mhm.
provider, or do you need to see another specialist and things like that? That once again made it like I was spending more time with patients than that what is allowed in a standard practice. So I was, kind of struggling with that idea that, do I remain an associate or a junior associate in a practice, or do I really set up something that was really catering to what my passion was and what brought me happiness of doing my work,
Mhm.
right? I left one practice. I joined another practice, which was a little bit smaller practice, and both of us, the provider that was there, and I had a very similar thought process, and we were like, we want to do what is needed
Mhm.
comprehensively for our patients, not just focused on dental work. However, she was hoping to be able to step back as I start. Well, we found that as I moved to that practice, a lot of my patients moved with me. And, if you think about DMV, Northern Virginia area, distances may not be as big, but traffic and
Mhm.
the travel time
Mhm.
was crazy. So if we were seeing patients who were traveling all this way from different parts of the area, and the practice was kind of small and not being able to absorb all that extra patient population, the wait times and the practice model was once again, even though it was the same, it wasn't the same.
Right.
So after a lot of thought process and just like trying to find a niche in the old practice that was already there,
Yeah.
I decided it needs to be something that is catering to laser dentistry, newborns, special needs, a family, not a
Mhm.
family dentistry, but the family of the child patient. So
Mhm.
Smile Wonders came about as I can't do this without having Smile Wonders.
Mhm.
So that's how my journey. I was never like a business owner. Obviously, all the things I've told you, and you are my practice by numbers person. I know you are like, Rashita, I don't know what you're talking about. You have to be able to focus on numbers. You have to be able to know. But that's why I have people like you to help me with those things because I am so focused on this is what I do for my patients, and then
And that's
other things
important,
come.
right? The thing is that I think if you find your passion, your little calling within
Yeah.
dentistry, right? That it's funny. I tell my kids this. I have a junior in high school, and I
Ah,
told him, I said, you need to find your passion. Don't worry about the rest. It will
yeah,
come. Even the numbers will come. Everything will add up, will match up if you find your passion.
yeah,
And so it's so, so, so important. Numbers are important, but they help you organize your passion, I
yeah.
would say,
You're
you know,
right. Yeah,
because with your passion, you can say, okay, you've created something. Now, once you've created something, how do you organize it?
yeah.
That's where the numbers come into play. And
You're
so
right.
it's kind of hand in hand, but you need
It
to have
is.
number one first.
Yes, exactly. And I agree with you so much because I feel like, and over during the summertime, we have a lot of interns that come to, and I agree with you, and I share that message with them too, is if you love what you're doing, the hard work is enjoyable.
Hmm.
But if the day that I say that to myself and my husband and I talk about this often, is, I still love going to work, seeing my patients and things like that after having practiced for all this time, is because I feel like the choices I made got me to a place where I'm able to do what I enjoy
Hmm.
versus getting to a place where it's the hard work being passionate and enjoyable versus the hard work that is stressful.
Yeah.
you know so that's my hope, that if this is the way our journey is going and I'm able to spread my message and I'm able to have people that seek out to come to Smile Wonders, not just because we are something that is listed on their insurance list, or not just because she is here close by, but because most kids and most families can be served by so many of my good colleagues that are there,
Mhm.
but there are some patients that just need a place where they are, catered to in a different kind of way.
Right.
Those are the patients that come to us. During COVID, when most of us were having to shut down our practices, I had pediatricians and some of my colleagues call me and, is there any way you can see some of these patients? Is there any way you can stay open? And I had to talk to my team, and I go, at least two of us. And we made like A team and B team and all of those. And I try to keep the people around me that are as passionate about what I'm doing as well, right? Like my team is not huge. It's a small team. We work hard, but we also all have the mindset of we'll do what the patients need and then the rest will come, right? So during COVID is when I was doing all the crazy things that we did.
Mhm.
Staggered patients, A team, B team, I already mentioned, having appointment times in between. You remember all the
Yep,
foggers and things like
yep,
that we used to do in our practices, right?
yep.
We did that for our special needs patients who used to otherwise get services in the schools,
Mhm,
and they lost those services,
mhm.
right? Because they're not going to school.
Right.
Parents are busy because they were having to do remote work.
Yeah.
So you will not believe during COVID, and many of them have still continued even now, so many years later, is I used to have patients come in for monthly cleanings. And when they come in, you can tell they probably didn't get a really good brushing in between last time I saw them and this time,
Oh.
because it used to happen with their OT at the schools.
Mhm,
So, and but if I was not in my own Smile Wonders,
mhm, mhm,
that would not have been easily implemented.
mhm.
Right. So I feel like Smile Wonders has come as such a blessing for me and such a blessing for the community that I serve, that I'm able to continue
That's
doing
amazing.
what I'm doing. And my hope is that as I am now stepping into the phase where you were talking to me about, like, so when are you going to start doing your teaching and things like that? My hope is that we can make little mini Smile Wonders in
Mhm.
different parts of the country.
Yes,
And hopefully I can have, they say you need two people to start something different, to revolutionize something. My
yes.
hope is that I've already started offering in office trainings and things like that for um, laser dentistry and infant frenectomies, or frenectomies for infant toddlers and children and things like that. And doctors from all over America so far have come
Mhm,
in small groups or small teams
mhm,
with
mhm.
their teams. And when they leave, my hope is that they're taking a little piece of Smile Wonder seed and like planting it
Oh,
there so that it grows in that part of the country as well.
that is just so, so awesome, that and heartwarming because it is such a need, right? And you like you said, you take care of frenectomies, you help children with tongue ties. I mean, these are so many things that as a new mom, a lot of the times women struggle or moms
Yeah.
struggle with that. And when you have a child or a newborn that has feeding problems and you take them to the pediatrician and the pediatrician just says, oh, I don't know, or the lactation consultant then says, well, either your latch is not good or something's not good. And then you keep wondering, well, I don't understand how the latch is not good. Is it anatomical? Is it
Yeah.
physiological? Is it me?
Is it
And
me? I
is it
know.
me? I mean, I have two kids, and my first son, my first one, my son, he had a lot of latching problems, and I am a dentist, and I was
Yeah.
like, there's something not right. And my lactation, this was a while ago. He's 16 now, but my lactation consultant at that time, she would just be like, oh, I don't know, you're not positioning him right. You're not doing. I'm like, I don't think this has anything to do with positioning. And it was, for me, those first few months as a new mom, feeding him was so, so, so challenging that I was like, oh, I don't know if I can have any more children after this
You're
because it was really, really rough. And I was like, how do so many women do it? They make it look so easy. There's got to be something else. But I couldn't get any answers. I got the
right.
answers way, way later in an orthodontic appointment.
Oh, there you go.
See?
So that is such a
Yeah.
classic example of what sort of used to, and you want to say what used to happen, but
Hmm.
unfortunately it still happens. And I have a very interesting story, and I'm so glad you brought this up. I knew you were going to bring that part into our conversation. And I want to put in my shameless plug for, please watch my TED Talk, guys, because that is my journey that I want to share with everyone. Because we all go through some of the times where, am I doing it right? Is it
Mhm.
me?
Mhm.
And many times I feel like there are so many things that happen in that newborn time frame, right?
Mhm.
There's so many things that we want our baby to so desperately do well that
Mhm.
we go out of our way to say, can I help this? Can I help this? Can I help this? Right? Myself.
Mhm.
Just like kind of what you mentioned, and you're aware I had a little longer journey of even having a baby and stuff. So my mom's guilt was like phenomenal, right? I
Mhm.
was beside myself. And on the one hand, I'm so happy for this blessing that I've waited for so long. And on the other hand, it was as if I was failing.
Mhm.
And then I'm like, oh my gosh, maybe it wasn't meant to be. I'm like pushing nature. I am not doing my job right. I am not doing this correctly for this baby that I brought into this world.
Mhm.
And there are so many things. Like you found out later, many moms find out later, but then we go through this phase where we are judging ourselves or other people are trying to just console us. But then it seems to us like they're passing a judgment on
Right.
our ability
Mhm.
versus really kind of looking at it a little bit more from a problem solving
Mhm.
kind of way. And
Mhm.
so my story is was already providing lip and tongue tie releases and things like
Mhm.
that for patients. But it was so kind of weird that it was almost like it's like a dissociated thing in our minds, right? That I can do this for patients and things like that. But when it came to my baby having a hard time, I didn't want to think about that.
Mhm.
I felt like I don't know how to be an effective or good mom. So let me handle that first, and then I can think about anything else. I
Mhm.
would not even, there would be many times I wouldn't even identify myself as Rashida Jaju or Dr. Jaju or
Mhm.
anything because I'm
Mhm.
like, just pretend like I don't know anything. Just tell me everything,
Yeah.
you know? And the funny thing, and I will never forget, and even my husband shares this, but he's not that involved or he's not that into like talking about what his wife does. But
Mhm.
this is something that kind of helped him see the other side where we were at the pediatrician visit. They're doing this, 2-week checkup and things. And
Mhm.
I am super postpartum hormonal, feeling like already my baby had lost all this weight and not gaining weight enough and stuff like that. And the lactation consultant that I did not recognize, I didn't know them or anything, but um as I'm like, and I relive this every time I talk about it. And it's so sad. As I'm like, in that space, she's like, "Are you Rishita Jaju?" And I'm like, "Oh no, are you Dr. Jaju? We send patients like this to you. Do you think he has a tie?"
Mhm.
Crazy, right? Like I'm
Right.
getting goosebumps even while I'm talking with you. Crazy. And I was like, I didn't even think about looking in my child's mouth
Mhm.
because he was my perfect angel baby
Mhm.
that I worked so hard and a blessing, right?
Mhm.
And to me, I was like, there's so many things I need to learn, I need to do. And everybody else kept saying, he's growing okay, he's gaining weight, he's growing okay, he's gaining weight. Nobody was really focused on how much effort are you having to put for him to gain weight.
Yeah.
And that was kind of that is my message. I want everyone to say, obviously, we want our children and babies to do well. Obviously, we are going to do everything that's in our power to help them.
Of
But
course.
breathing and eating should not be hard for
Yeah.
babies. And if they are having a hard time, and if our feeds are not as effective, enjoyable, calming for our babies,
Mhm.
then there could be something else happening. Of course, we all have to learn to be a mom. Of course, there is going to be hardship in the beginning. For God's sakes, lack of sleep, right?
Right.
But if it is going on for more than 2 weeks, we should then get into our like professional a little bit problem solving mode versus like the consoling, it will come together, they'll grow
Mhm.
up, let the mouth become a little bit bigger and
Yeah.
all of those things.
Yeah.
So until I became a mommy dentist,
Mhm.
I was a very good pediatric dentist, but
Mhm.
not really a mommy pediatric dentist.
I understand.
But I feel like now I am able to connect the mom's perspective
Mhm.
with my patient care. And I
Mhm.
feel like that's where my um some sanity comes from, right? Like give
Mhm.
yourself grace, but then try to find the right things to do, but then give yourself grace.
Yeah.
And so sometimes when parents come to me and they're like, my son just loves candy. And I'm like, well, my son's favorite treat is the lollipop. And how much does that hurt to say as a pediatric
Right.
dentist? My son also needed a lip and tongue release. How much does it hurt to say that my perfect angel baby needed to be treated at that time? Anyway, I feel like that has definitely influenced my practice and definitely influenced how I take care of. So I feel like there was the sympathy, compassion, passion for dentistry, which now I feel like is gone towards the passion for parenting and dentistry where they can meet together
That's
as well.
amazing.
So that's
That's
what I'm
amazing.
hoping that
That's,
we can.
so becoming a mom has really influenced your practice of dentistry because it has changed, it has given you, I guess, perspective from a
Yeah,
mom's angle that it is a relationship where it's not just a patient and a doctor.
yeah,
It's not just that child and you. It's you helping that child, is helping that mom, is helping that family. And because the mom is the cornerstone of that
yeah,
child's life,
yeah,
and giving her an answer and making her feel understood, you know, understood not just as a woman, but as a mother. I
right.
think that itself is so empowering, Rashita, because there are, if I had had that, you know, I don't think I would have waited 5 years till I had my second one because
Right.
I needed to heal completely, physically, emotionally, mentally, from having my first one before I could have my second one because it was really
So
hard for me.
challenging.
It
Yeah.
was so challenging.
Yeah.
So
It gets the I feel like there's gonna be challenges as a parent.
yeah.
There's gonna be guilt that comes. And as a professional, we feel guilty about so many things, right?
Yes.
Had to miss the performance or
Yeah.
had to miss this practice or couldn't be there to pick him up from that golf thing. Who there's who knows how many things there will be.
Yeah.
But then if there are some things that we can actually medically help,
Yeah.
then why not?
Yeah.
And that's
Absolutely. I think
that
moms are the best advocates, not only for their kids, but for themselves. And
yes.
honestly, I have seen that myself time and time again, first with my son, then later with my daughter. It has been always about me pushing forward, me pushing and advocating and saying that something's not right and I need answers.
Yeah.
And, I'm so grateful that there are providers like you out there who are like, yes, there are answers, there are different ways to approach a problem, and understanding, listening, not hearing what your patient is saying, but listening
Listening.
to
Mhm.
what they're saying so that we as providers can, if we can't help them, at least we can point them in the right direction. And
Exactly. And I
that is
think that is the
key.
most valuable key, right? Valuable thing. Because none of us are always going to be able to answer everything.
Right.
But we can say, I feel like this is the best kind of what I'm thinking. Maybe if the problem continues,
Hmm.
let's revisit. whether this is something we need to look for other answers for.
Right.
Right? Like, I feel like give yourself a little bit of a time perspective as well
Yep.
as grace that you may not know answers to everything and you may have a limited perspective on some of those things, but then I feel like the worst thing that happens these days is people say, I don't see anything.
Mm.
Well, excuse me, when you say I don't see anything, you are not realizing that you are admitting that you don't see it, but you are dismissing the problem. It's like this, we talk about this world of dismissive or canceling the issue. I think that's sometimes what happens when patients come to me or find me after having struggled. There has at least been few people that have kind of mentioned it or kind of dismissed it in such a way. And then the mom feels like maybe it's just how it's meant to be.
Right.
Until they keep growing, and then the next milestone, and then the next milestone, and then the next milestone, the child keeps kind of having to work around.
Yeah.
And so as a provider, I feel like many of our audience today are going to be fellow providers, colleagues. I hope that just from this conversation of like knowing, like we know, but we may not know all.
Right.
Right.
And that's okay.
Yeah, and it's
That
okay.
is okay. We've both been, you and I think, in more than 20 years in practice. And
Yeah.
I could say that I still don't have the answers to everything,
Right.
and I'm okay with that. There was
Yeah.
a time when I wasn't, but
Mhm.
now I always, and I've spoken to many, many providers now, who are doing fantastic things in dentistry. And the one thing that I have been learning and speaking with them is that they always say, you know what, Aditi, when somebody asks you a question or when a patient asks you a question and you don't have an answer, have the confidence to take a pause and say, you know what, I don't have the answer for you right now, but let me come back to you
Right.
because I have access to ways to find an answer or access to people
Yep.
that can help me find that answer. Either way, give me some time and I will get back to you. And that has been so, so, so powerful because you find connections, you meet people, you understand people, and especially now in the online world that we are in, with the number of resources that are available to providers, it is insane how we can really help people. I just had a
Yes.
patient the other day, just actually 2 days ago, who has an hemangioma in the frontal lobe, and is causing pressure, in not on the optic nerve, but in on the trigeminal nerve, and it's causing his one side to droop
Drooping.
and his side
Bell's
uh,
palsy type symptoms, you mean?
Bell's palsy type symptoms. He's getting numb on that side and everything like that. Adult patient. They've tried radiation, they've tried surgery,
So
but
trigeminal would be sensory, and
yeah,
also you're noticing some motor issues.
yes. And
Okay.
he said he's tried everything, and obviously there's no relief. That he's on medication and all of that. But I had a conversation with him, and I said, okay, I know I can't do anything to help you with your symptoms. He's already on carbamazepine and, all those kind of things. And I said, but I know a great myofunctional therapist. Why don't I connect you with her? You know, I don't know how much it'll help you,
Right.
but it should help some because
Yep.
they've worked with patients with trigeminal neuralgia. Here we have a cause for the neuralgia, and I know that they can't really operate on that tumor because of the location. Oh,
But
they've
they can.
tried,
Yeah,
but
I understand.
let me see how I can help you. And believe it or not, Rishita, he looked at me, he said, really? You have somebody who can help me maybe even a little bit? He said, it doesn't have to be 100%. He took my hand in his and he said, Doc, it doesn't have to be 100%. I'm okay with that. I'm not looking for 100%. It brought
Help
tears to
me
my eyes.
improve my situation,
Yes. He
right?
said, just help me improve my situation. Even if it's 10%, I will take it. And
Yeah,
I then understood. I mean, I've had this understanding for a while, but then it really sunk in how desperate people are for
yep,
help and how they're willing to try modalities of care that are
yep,
different. But we as providers, we shouldn't be like, okay, I don't think this is going to work, right? Because myofunctional therapy is generally indicated for other things,
right,
not
right.
so much for this kind of situation. It's a different situation.
Mhm.
But unless and until we recognize and say, hey, you know what? Maybe this can help you a little bit. Would you like to try?
Yeah, and the thing is, I think that that is so important, what you just said. Knowing an application and understanding it well enough to say it may have an impact in this other situation as well. It's like you were not just hearing his problem and, oh, I can't do anything about it, move on. You were like wanting, you cared enough to think about it, to connect him to the right person, right?
Mhm.
Or offer him advice about a modality that did not necessarily directly translate to your service,
No.
right? It didn't have it's this is not going to, and that's kind of what I mean when I say um at Small Wonders or at my practice, or the reason I see patients is because I want to help them get better with whether it is me or within my service or my scope or someone I might know. And the days of knowledge is power is, yes, knowledge is still power, but who you know
Mhm.
is also powerful.
Mhm.
I may not know everything, and that's kind of what you just alluded to the example. You don't know how to provide myofunctional therapy, but you know that this person knows how myofunctional therapy can be applied in this situation.
Right.
And I think once we start giving each other more grace and credit and working together
Mhm.
and kind of just saying, I don't know something about how I can improve this, but I know someone else who can.
Mhm.
It's going to be such a good world, right? Like, I think
Yeah.
if all of us start thinking about that, it's going to
Yeah.
be so much better. And people don't have to have, like, in Nemo where they show the dentist
Right.
or, all these movies. I feel like we don't get the right,
No. No,
perspective.
it's a holistic approach. And, I think holistic approach to dentistry, everybody's shouting from the rooftops about the oral systemic connection.
Yeah,
And we've known there is an oral systemic connection. We should be the first advocates. We should be the biggest advocates. And we should be educating. It's our job, I think, as providers, to be educating our patients about the existence of this connection, about how important it is, first of all, and then when there are problems, how to possibly manage it. And
you're
I
right.
think it is the biggest responsibility as a provider, as we are settling into our provider roles, you
Yeah,
know, is to not just understand, but it is also to advocate that there is this connection and how can we educate our patients. We know it, right?
yes.
We
Yeah.
understand it,
Mhm.
but it is our responsibility now to educate our patients. And I know they're willing to listen.
Yeah.
We
Yeah.
just have to say something.
That's the key, because I feel like sometimes what we know from being able to provide the care perspective, but what we don't do is share
Hmm.
that perspective. That
Hmm.
is why we still have patients that, don't reveal their entire medical history to us, or because they feel like, what's it to the dentist,
Right.
right? Push that envelope a little bit. Ask them, is there, my biggest question, even if whether I'm seeing my toddlers or children, or if I'm seeing my moms that are coming to me because of feeding difficulties, I always ask, is there any other medical history for you or for baby that you haven't shared with me?
Mm-hmm.
Sometimes they don't know. And then they go, oh, actually, they said that my babies, renal function is not good. So there might be some congenital issue with that. So we have a MRI of the kidney scheduled in 2 days, which they never revealed on their paperwork or in any of the conversation. And they're talking about a procedure
Wow.
with me sometimes,
Mm-hmm.
right? So sometimes patients don't know to make those connections, but we
Correct.
have to make it our responsibility to let them know that I understand that there is a connection between oral function and systemic function.
Correct.
Once you bring that up and you own it, you own that
Mhm.
connection, then the patients will learn to once again trust as well. I feel like they're not, sometimes everybody, one of the things that we learn as a part of our education is, you know, there's always something hidden. Like patients know the answer, but there's something always hidden, and you have to do the investigative model or the
Right.
self-explanatory model, whatever we teach all our, the names that have evolved over the last decades of us practicing, last few
Correct.
decades. But at the end of the day, all of those lead to that thing. Have a conversation, right? Have a conversation with your families, with your parents, and care enough to help them make the connection between oral health and overall systemic health. And I feel once you do that, you will feel like now I have a better picture of their entire medical history. So you feel a little bit more empowered to
Yeah.
give them the answers
Mm-hmm.
sometimes.
Mm-hmm.
Sometimes they feel more empowered and trusting of you to then share
Mm-hmm.
with you. And then together, I feel like that builds the
Right.
love of what you do, that builds the love of them trusting you and wanting to come.
Yeah.
And hopefully that translates to more of us
Right.
loving what we are doing versus trying to just do that so that we can make ends meet, because that's become our career
Yeah.
rather than our profession or love or passion. By focusing on these conversations of how you can impact someone versus I do that part of doing dentistry,
Mhm. Absolutely.
So hopefully I'm not sounding too preachy, but you
No,
know.
no. I mean, I completely understand where you're coming from, and I respect so much in what you're trying to do. And, imagine this, that you are so passionate about what you're trying to do and so passionate about getting the message out there that you've even become a TEDx speaker, girl. I mean, that itself is like taking it next level. And that is just so cool. Tell me about that journey.
Thank you. So TEDx journey was interesting. I was not looking to become a TEDx speaker, but it was brought up as one of my friends who was not in medicine was like, the funny phrase like "Welcome to my TED Talk" has become a thing. Like sometimes that's what I was kind of feeling like. I don't want to sound too preachy, but it's like I said something came up, a friend's kid struggling, having, and I'm like, well, you need to do this, you need to focus so that, some of the things that we can take it so for granted or we can be dismissive, we need to do better in something, right? I don't actually, excuse me, even have a memory of like what that first conversation we were having,
Mhm.
which were like, girl, you need to have a TED talk on this.
Yeah.
And so that's kind of where the seed was planted. I'm so sorry.
No, you're fine.
But when after that, another time it came up was I was teaching or doing a study club with some lactation consultants, actually.
Mhm.
Study club. And that's where the conversation once again came up, and it was like a little joke, and I was like, you know what, I'm actually gonna research on this or mention it. I'm like, but then I heard that it needed to be somebody that is nominated.
You're right.
Well, in that group, someone nominated
Oh, that's so cool.
for being a TEDx speaker. And I was like so honored and everything in the beginning, but that was also another journey, because
Yeah.
to be able to be the TEDx speaker, you have to do, you have to accept the nomination, submit your application, the 1 minute video, the 3 minute video, the you know,
It's a process.
speaker training. I
Yeah.
know. And all of that. And then it is the reason the joke came about of welcome to my TED Talk is because I could talk for hours on this, right? And then they're like, no, at 18 minutes, you have to stop. And when I started it, it was 18 minutes is the max.
Mm-hmm.
As I was during my process, it became 15 minutes is actually
Good.
ideal time.
Mm-hmm.
And then it became, starting 2024, the guidance actually is, and I was doing this back in 23, but as you're going through the training, they're talking about what's up and coming and all that. The guidance actually is that with all the TikToks and the Instagram and the YouTube shorts and everything, they actually would like you to have your message ready and delivered in 12 minutes.
Wow.
And I was like, you gotta be kidding me.
Too hard.
Too hard to not get like off record. I mean, off the, digress from the message.
Yeah.
But at the same time, I saw their point. Like, if you really want your audience to be able to watch the whole thing and not just drop off, deliver your message effectively in 12 minutes. But I wanted to share so much.
Yeah.
Because
see, that's why you come on a podcast with me. You get to share.
I know, we could keep talking forever. We shouldn't do that.
We really could.
But it was a very, very good journey. My goal was, and the whole idea as they're training you was, what is your idea worth sharing with the world? And stick to that idea. All the extra things, do it in this setting.
Right.
So to realize what is my through line, to say, okay, this is what I want to share. And then recognizing, and during the speaker training is where I was recognizing what is my audience and who am I trying to, because my difficulty was, am I speaking to other fellow moms? Or really, am I speaking to pediatricians and other doctors and providers? So that's
who's your audience? Yeah.
Who is my target audience? And that kind of made it hard to be able to present the message in a way that was, that resonated with both those populations.
Right.
And that's where, if you really, watch that TED Talk, which you can search TEDx and Rishita Jaju, and it is on the YouTube TEDx channel.
It. Yeah.
And so
you were amazing.
Yes, thank you. And so you hear the part in the end where I was like, if you are a mom, empower yourself. If you are a provider, definitely go and try to solve the problem before you go into the consoling and sympathetic mode. Make sure that you are not missing something that could actually help this mom's journey and not derail the journey before it even starts. So yes, it was a great learning experience. All the people that I was presenting with were non-medical people, but they were affiliated with medicine somehow, because it was a health and wellness salon in which I was presenting. And the whole the practice journey, the getting your message distilled and presentable and all of that was definitely an experience. And then the cherry on the cake was it was in Delaware, which is not
local,
too far, but it is not here. And so we go to this, and every time I've done a talk like this, or every time I've done something that I have tried to bring my message, at the end, I always have someone or the other say, I had the similar experience and I had to do this, or I had to find out later, and things like that. In Delaware, we are in Virginia. After my talk and in the audience, I had 4 people come up to me, tell me that they have had similar experiences. One was a mom, just like how you were kind of thinking about your own experience, she was doing that. One was a hospital provider who kind of shared his experience with it. And he's like, it's so hard to tell. We don't want to make a mom even more hesitant. And as a hospitalist, what all can I really even talk about in that first 24 hours? And we're talking about that. The third one was a person that said, can you come to our area and, do a talk like this and stuff like that. And the fourth one was a parent who had traveled from Delaware to come to my office in the thick of COVID to get their child treated. And once again, and I keep bringing this up, my husband, the way I talk about him, he doesn't sound like very supportive. He's a very supportive guy. I did do a good job in picking him. But he's definitely your hands-off Indian dad that is like, you do your thing, I'll do mine, Those are the couple of times, like the time where we had to take care of my son, and then the time that I did my TED Talk are the two times I can really, really see his non-medical side, like stepping in and being like really proud to be part of the movement.
Yeah.
And he got to hear, oh, that guy came from Delaware to come see you, huh?
Yeah.
And you understand the dynamics of Indian family and Indian couples, and like sometimes it's like he's like, you do your thing, I'll do mine, not want to be as involved, but then all of a sudden he was like, oh yeah, my wife.
Yeah.
She's a TED Talks, speaker. Like that
You're like,
like,
dude, what
resonated
all
with
do I
you.
have to do to get your attention?
Like 20 years later, guys.
Wow. Well, one last question. If somebody wants to learn from you, Rishita, how can they reach out to you as providers if we want to learn more about laser frenectomy, infant health? How do we get to you?
Wonderful. So there are, bouncing back was my 2024 giving back, bouncing back into my profession and teaching and all that. And giving back to my profession was my theme. So there are a few ways you guys can learn about infant frenectomy or laser dentistry. I have a course that is being offered in 2025. If you've heard of like Airway Summit, it's coming up in September. It's in Texas, and I'm going to be talking there about infant frenectomy and the role of oral health, tongue posture, things like that in proper breathing and feeding. In 2025, there are a couple of times that I'm actually doing a 2-day course on diagnosis, literature, treatment planning, things like that with ASAP pathway. You've heard of that as well. Like it's a nice group. Tracy Wen and Michelle and Stacy are a part of that group, and they are hosting it, and it will be in California and then Virginia in later part of the year. I'm also offering a foundations course through BioLays as for like BioLays users, not just like for infant oral health. It's specifically more for using lasers and you know how to do a really good, clean, thorough, like the skill level, as well as how to collaborate with other providers for best outcomes. And then the one-on-one laser frenectomy in, hands-on type course we offer in our office. So you can bring your team, and it is, in a way, I hate the word required, but it's almost like a requirement that you come with your team, so that you're not just coming to hear and watch and see and observe. It is also how to implement it in your own practice. Remember, I am seeking out to have little mini smile wonders, plants planted all over America in different practices. And, you get access to all of how I have come up with all my intake and what I use as a way of communication with other providers, with moms and things like that. And you get to see my team and me in action for 2 days as well. So many different ways. On our website, there is a section that is coming. It's in the process of finalizing, but there is a
Mhm.
section on our website that talks about Pediatric Laser Academy, and all of
Yeah.
these levels of classes will be on it.
That's so awesome. Thank you so much, Dr. Jaju. It was so fun talking to you today. We have spent many hours talking about everything, from teeth to jewelry,
Yeah,
and
you're right.
and I am your biggest fan, really. And honestly, love the message, love what you're trying to do. And I think it is so important. And just know that we here, me as Dr. Aditi, and then also my big team at PBN, are always going to be your biggest champions. As you grow in your journey, we will always, walk hand in hand with you, really.
Thank
So,
you. That means a lot. Thank you so much. It's been great getting to know you over the past few years, and I feel like you are, more like a sister almost,
oh, thank you.
as once you go jewelry shopping together.
Yeah, all bets are off.
And so it was, it's always been much of a honor to get to know you, and pleasure. I feel like we have shared professional and personal journeys with
Yeah.
each other, and this was so nice of you to invite me to be able to be on your podcast.
Oh my
I know
gosh,
this
it was.
how important this is for you, and for
Yeah.
me to be one of the guests. I really appreciate it.
No, absolutely. This was something that I've been looking forward to. And I know, and you have such a wealth of information. And I think the providers out there need to know that. And, there's so many things, like we said, we need to show the younger generation that it's not one tooth at a time, it is
Uh-huh.
one mouth at a time.
Time. Yes,
So,
absolutely. That's amazing. That is so right. One mouth at a time, one patient at a time.
yeah,
A whole body, a
yes,
whole mouth, not
yes,
just don't limit yourself to
yeah, exactly. Well, thank you, Dr. Jaju, and look forward to connecting with you soon.
sounds good. Thank you so much, Aditi. I love it.